You may be surprised to know that, well, anesthesia care providers are one of the only classes of physicians that prepare their own medications. Typically you have pharmacy or nursing preparing. But for anesthesia, they're preparing and then administering their own medications, but yet they've had no training in that. Their training may be on the job and may be provided by their attending physicians who also had no training. So I think bad habits and lack of understanding and knowledge is passed on, in that manner. So I think this is a really good area that pharmacy can have a big impact. And we've started at our hospital, we've started a involvement in a training program. Our anesthesia faculty started a safety, for the new incoming CA1s, they started a safety orientation right when they came in July. And we were allowed some time in that and started doing some aseptic technique training. So I started that maybe 5 years ago, and I'm not really in the OR now, so our OR pharmacist has taken that over. And I think we really need to do more with it. Like last summer, he did more of a demonstration, but I really think that they should get some hands-on training in opening ampules in a aseptic manner. And of course, they're not working in hoods like pharmacists are. They're not working in a biological safety cabinet. So it's more avoidance of touch contamination. And there are a lot of erroneous ideas floating around out there among anesthesia care providers. For example, using alcohol swabs is fairly rare sometimes. Using filter needles when they're withdrawing drug from an ampule, you don't see a lot of that happening. We've introduced and tried to enforce both of those practices. Even things like a lot of the anesthesia care providers think that the top of the vial underneath the cap is sterile, so they don't see a need to swab with the alcohol pad. And of course, teaching them that that's not the case, is important. But with the One and Only campaign, it becomes really egregious. There, with the number of patients who have been contaminated, hepatitis C, hepatitis B, HIV, from care providers who use the same needle or the same syringe or both to re-enter a vial, using single-dose vials without preservative for multiple patients, or even misusing multiple-dose vials. There's just not a good understanding of the principles of safe injection practices. There may be some wanton disregard of that, but I think the training was just not there. I think that's the primary issue, and that's what the CDC has recognized and is trying to promote. And I think it's a good area for pharmacists to get involved and do some training in the operating room with anesthesia care providers in particular.